Singapore wakes up.
Wake up,
Glenn, Angel, and the Flying Dutchman.
wake up in the morning feeling like
Kiss 92's Big Show.
Good morning, Singapore, and welcome to the biggest and best breakfast show in Singapore. And, today, our very special guest, who's on the way into the studio, is Dr. Leong Hoe Nam, Senior Consultant, Infectious Diseases Physician at the Rofi Clinic.
Yeah, he's going to. We haven't seen him in a while, and we're going to be talking to him about everything and anything under the sun when it comes to health, because a lot of people seem to have been falling ill of late. So we want to find out what's going on.
It's crazy. You go to your average neighborhood clinic now, and it's chock-a-block with people.
Of course, yeah.
I mean, I've been sick for the past 10 days.
Yeah.
There you go.
And now I feel like I can smile.
Again,
Finally,
right? And,
yeah.
and it's not nice, though.
When I came
What,
in...
his smile?
No, being
sorry.
sick. Being sick. FD.
You were sick as well.
I was sick as
You were
well.
down with Influenza A.
Yeah.
I was down with Influenza A, and then a week later, thereabout, maybe slightly more than a week later, I was hit with COVID
Oh,
Yeah.
for the first time.
for the first time. I thought I had recovered after 5 days,
Yeah.
but I had not. The funny thing about what happened to me was the first 5 days, no symptoms. I didn't feel anything. I felt normal.
You were just testing positive.
I was testing positive, yeah. And then I tested negative, and then I came to work, and I went home, slept, woke up feeling so ill.
Awful.
Wow.
The next 5 days, I felt so ill, and that's why I stayed away from work.
Right.
Yeah, it's
right,
crazy.
Right.
And
'Cause
then,
in my heart, I felt like I was still positive.
right.
Oh, wow.
But nothing was
So if
showing.
anyone were to ask me right now, hey Glenn, your first COVID experience, how long did it take? I would say 9 or 10 days.
And you were saying there was no temperature, no symptoms, but
Nothing.
you felt...
I had absolutely no fever.
But you were burning
no
up.
fever. But I felt a little warm.
Yeah.
Yeah.
Usually when you have a fever, you feel cold.
Yeah, a bit of both.
Right.
It's
Yeah,
hot, cold,
yeah,
hot,
it's hot,
cold.
cold,
Yeah.
yeah.
But I just felt, I can't even describe it right. I just felt so ill.
That's crazy. That's just
Ill
absolutely
and
nuts.
weak.
Well, you know what? It's a good thing we have a doctor coming in.
I know.
We can ask him the questions.
It'll be quite
that-
interesting.
Yeah, and if you have any other questions at all, you can always type it in on our comment section on our YouTube or Facebook channels. Or if you're listening to us on air, send us a voice note, type in a question to our WhatsApp number. It's 88550920.
Hurry up. Coming up very, very soon.
Hurry up.
Hurry up. What's
Hurry
up? See?
Okay.
Your brain is
Coming
still not
up- no.
working.
Coming up very soon, Dr. Leong Hoe Nam, who is probably in the lobby right now on the way up. Senior Consultant, Infectious Diseases Physician from the Rofi Clinic. You tuned in to The Big Show. It is Monday, the 24th of April.
Kiss 92 Day Check brought to you by Gain City Megastore at Sumaikaro.
Coming in, we want to hear from you. If you've been unwell, if you're feeling some sort of symptoms and nobody knows what's up, we could ask. It's your doctor in a pocket today.
Doctor in a pocket, yeah.
No consultation fees here.
It's interesting because you went through so much when you had your COVID. I remember when I went through my COVID when I was in Australia. I had a fever for a day, and then I felt normal.
Oh, it's just one day.
Yeah, I just had a fever for a day, and that was it. But again, it took me 7 days to get
Did you
get
feel
negative.
ill?
No,
Not at all.
not at all.
Wow.
Only
okay.
that one day when I had the fever, and all I wanted to do was sleep.
Yeah.
But after that, once the fever broke, I was fine.
Mine
It's
was,
really very
my
strange.
first one was, gosh, I don't even know if it was 2021. Yeah, I guess it was 2021. I don't think it was
You were one of
2020.
the first, I remember.
Yeah.
In the station,
Yeah.
I was one of the first. And I remember sort of like tasting food. I didn't know I had COVID yet. And then things started to taste tasteless. You know,
Right.
I was having a soup that we made, and our soups are fantastic usually, right? And I took a couple of spoonfuls, and I was like, I better not tell the husband, but this is like really bad soup. It was like so tasteless.
bland.
It was so bland, and I just didn't want to say anything. I'm not that type of person to say this is
Yeah.
crap, right? And then it happened with the rest of the food as well. So I was like, oh. Like a day later, I was like, I've heard of this. And then I did my test, and true enough, I had COVID. So I had lost my sense of taste and smell for, I think, the 10 days that I was unwell. But good thing it came back, because I've
Right.
heard people go on without their taste and smell for like months on end.
Wow.
And it's not nice to have, because you're eating things. And I think from memory, like I was having ice cream, I knew how that ice cream flavor tasted. So my mind told me
Okay.
what it tasted like, but my taste buds, my nose could not smell or taste anything. So it's very strange.
So the different variants kind of gives
Different
everyone
symptoms.
a different COVID experience.
I think so, yeah.
Yeah.
So yours was the
Delta.
Delta.
No one told me it was the Delta, but Delta was the only thing around at the time.
Yeah.
So I assume it was the Delta. Omicron
Right.
didn't come to much later.
Yeah, mine I think was Omicron.
Omicron, yeah.
Honestly.
And
I
then
think
mine
my
could be
s-
XBB.
Yours
Could
could be.
be.
And then I think my second round was Omicron because I had it twice,
you
right?
had it twice, yeah.
I think the good doctor will be able to tell us, based on our symptoms.
Yeah, I guess.
What it was.
Yeah.
Yeah.
That's why I also want to ask him: does Delta become Omicron, become XBB, or are these still the various variants still around? Is Delta still something
right,
that
I
we
see
can
what you
get?
mean. Yeah.
Yeah.
You know what I mean? Or is Omicron something that we can still get?
Or
Or
has
is
it
now
all just evolved into XBV?
something else like a flu bug?
Yeah,
If you're
yeah.
watching us right now, I'm sure a friend or a relative or maybe you yourself, when you got COVID and you experienced these symptoms and all that,
Yeah.
and you wanted to ask someone about it, but never got down to doing
Couldn't,
it,
yeah.
make sure you put your question down
Yes.
so that we can ask Dr. Leong your question
Yeah,
today
yeah.
on the show.
I mean, you can type it in. Obviously, you're watching us on Facebook or YouTube.
Yeah.
Good morning to Winston, who's on YouTube with us. If you have a question at all, type it in the comment section. But if you'd rather send us a WhatsApp, you can do that as well. It's 88550920. Also, something else that's going around is Influenza A.
That's right.
Which you were
Oh my God, it was
privileged
a-
enough
Which
to have
is no
both.
fun.
Double whammy,
It is
man.
no, influenza A is no fun.
And
It's
you had
painful.
it as well.
Your body seriously aches.
I can't remember the last time I was this ill.
Yuck.
Really?
I can't remember the last time you were this ill. I worked with you
Maybe
for
it
how
was
many years?
years ago when I contracted dengue.
Dengue. That was the last time. Yeah.
okay.
And I was out for
okay.
like 7 days for that one.
Wow.
Yeah.
And this time round,
Just
even
at least
longer
9
than
or
that.
10 days.
Just as long, yeah.
Wow.
Oh,
It's
and
been-
that's not even counting influenza A, actually. The 9 days.
That
The
was
9 days
COVID.
was just COVID.
COVID, yeah. But your
Yeah.
influenza was about a week, right?
About 3 or 4
3
days.
or 4
yeah.
days, yeah.
Horrible!
So yeah, if you've got influenza A, or if you've got people that have it, or COVID, or you don't even know what it is, your immunity seems to be lower because for the 2 years we were all masked up and all
Yeah.
that. They say that's lowering
Actually,
our immunity as
the
well.
one question I want to put to Dr. Leong is I've just come off influenza A, so I've been full of Tamiflu and all these other pills, right?
Oh, I took Tamiflu as well.
Yeah, because that seems to be the only thing that's working with influenza A, right?
And not
So-
everyone can take Tamiflu.
And not
you know?
everyone can take it. So I only got enough Tamiflu for a day and a half.
Wifey couldn't take Tamiflu.
Oh,
really?
She felt really ill after taking Tamiflu.
Oh, so not
Yeah.
everyone can.
Not
Yeah.
everyone
Okay.
can take Tamiflu. But with all this stuff in me now, am I actually is my immunity down or is my immunity up?
I think it's up. It should be
Yeah,
up.
which is it? Because I'm coming out of a sickness. So which
Because
is it?
you've built antibodies now.
But
as a
I'd also
result.
like to
Yeah.
find out. I mean, no disregard to the both of you, no offense, but I mean, he's still coughing.
I'm still coughing.
You've got a
I'm
little bit of an itchy,
itchy
right?
throat, yeah,
I want to
scratchy
find out
throat.
is he contagious?
That's a good question.
I mean, I want to know because
That's a good question.
I mean, we are always told to cover our mouths,
Yeah.
cover our,
Yeah.
when we're coughing and stuff like
Yeah.
that. So I want to know: is influenza A contagious?
I think it is.
It's a
Well,
flu,
I've
right?
spoken
It
to a
is.
doctor. Influenza A is very, contagious.
Oh,
So
okay.
you see, it's an interesting thing.
Yeah. Okay, let's go back on.
Kiss 92 traffic.
On the PIE towards the airport, right after Simei Avenue, a vehicle has broken down. Same thing on the PIE, but this time heading towards Tuas before the BKE, a vehicle has broken down. Look out for that and stay safe.
Good morning, Singapore, and welcome back to The Big Show. It's Glenn Angel and the Flying Dutchman, and our guest who is on his way up right now is Dr. Leong Hoe Nam, Senior Consultant, Infectious Diseases Physician at the Rofi Clinic. And we knew Dr. Leong was going to be a little late. I mean,
Yes.
we got in touch with him last week, and he said, he wouldn't be able to make it
I think, yeah,
at
yeah.
8 a.m.
8
today.
too.
We said, it's fine.
It's
Just a
fine, yeah,
little
fine.
after 8 is okay.
He
But
had
we
some
really,
errands to
really
run.
want him on the show today.
Yeah,
There's an
absolutely.
interesting comment on our Facebook page from Aloysius who says, with influenza and COVID still around, the question is asked, should MOH make mask wearing mandatory again on public transport in crowded places? Do we need to do this? Or can't we just be socially responsible enough to know
Yeah.
that you wear it?
Common sense. Remember,
Common
we were
sense,
talking
right?
to Ong Yi Kang the last
Yeah.
time
Yeah.
round. I think we're all, knowledgeable enough about this.
We've gone through enough over the 2.5 years.
Exactly.
Yeah, you should know.
I have started, bringing my mask out if I go to crowded places now.
Yeah.
There was a time I didn't.
Yeah.
The recent rugby sevens. Mm-hmm. I mean, I was just mingling. Luckily, I didn't catch anything.
Yeah.
Or
So
maybe
you
I
didn't.
did.
Yeah, I know. I'm just thinking. I'm trying to look at
could
the
have
dates.
been the Influenza A.
It could have, yeah, because it was super crowded.
But just like COVID, right? Influenza A is an endemic as well,
Yeah.
right?
yeah.
So,
It's-
which is why it's important today that we have Dr. Leong Hoe Nam in the studio, because I want to ask him if, all this is something that we should be taking in our stride and not panicking over. You know what I mean? Because of the fact that the government has said that we are working towards an endemic situation.
Yeah.
Yeah, and I think people just need to be responsible individuals. I mean, we've learned enough about how we can keep our own personal hygiene intact, right? If you're coughing, like today I was in a Grab coming to work, and the guy was coughing and he wasn't wearing a mask. So I put my mask on.
Yeah.
You know
It's
what I
what
mean?
you do.
I'm not going to say to him, "Oh, you should be wearing a mask." But if each one of us is responsible enough to know how to cover up whether we're ill or whether we're around someone who's ill, then maybe the numbers will be lower
Yeah.
as well.
Yeah.
Because the trains and buses get super crowded.
They do.
And
They
majority of the people do get around on public transport. So if washing your hands and putting on a mask is what it takes to keep yourself safe, then do it, right?
But I feel everyone's coughing.
Everyone's
I was
coughing,
out
you're
and
right.
about
There are a lot of
yesterday.
people coughing.
Everybody is coughing.
and you
There are a
hear
lot of
it
people.
more, right?
Yeah.
Nowadays, like
because you're more conscious.
you're more
I've never
yeah.
had a cough for this long,
Yeah.
Just scratchy throat. It's
It's
just
just a scratchy
irritating,
throat.
right?
I mean, just you guys talking about being ill, I feel like my bones are starting to ache.
Yeah, well, yeah.
I'm
I
starting
think that's
to feel
part of the
sick.
brain.
Okay, doctor
Dr.
is in the
Leong.
house. Good
okay,
morning,
it's
Dr.
Dr. Leong Hoe Nam has arrived.
Welcome to
Good
the
morning,
studio.
Dr. Leong.
Morning.
Good morning,
Good
Kiss
morning.
92 fans.
You're looking great, Doctor.
You're looking so good.
How have you been?
I've been all right. I came on this show specially
Ah.
because I wanted to be with the crazy bunch this morning.
You needed some crazy in your Monday.
Absolutely. A bit more kiss in the morning. Well, it makes my day feel good.
Okay.
Thank you for joining us this morning. We were just talking about how crazy it is that everyone seems to be dropping like flies with COVID-19, whether it's you've got your mask, yes, COVID-19, Influenza A, this and that. Like, why are so many people getting ill?
Spot on. And I was driving and I heard it. I said, wow, this guy's had COVID. This guy's had influenza A.
Yeah.
I better come in here with
my
my
mask.
mask.
Yeah.
Be a responsible human being.
You see, that answers your question. Angel wanted to ask you, Doctor, if Influenza A is contagious.
Is it?
Absolutely.
Okay.
It really spreads very well. For each individual it spreads on to another 1.6 individuals.
Oh.
Okay. But influenza has never been as infectious as COVID-19.
Okay.
COVID-19 beats it easily. One person will spread 5 to 9 individuals.
Oh, wow.
And when you say COVID, do you mean COVID-19 as a whole, including Delta, Omicron, XBB, all that is the same numbers?
No.
Okay.
If you go back to the Delta or even go back to the Alpha, it was just about 1 to 2. But if you go back now to the Omicron, in fact, the XBB or the Angela Baby version of it. Okay, that's a tease. Okay, Angela Baby, don't get upset with me. So if you actually look at the XBB versions of it, it goes up to 5 to 9. So you see,
okay.
all of us as humans, we ought to improve. The society has to improve, and the virus improves too because it runs faster, spreads faster. That's how it outruns its peers. Think of them as all as cousins, and the one that dominates will be able to shed the rest of the genes downstream to its.
So that means XBB would be the dominant now, but there is still Omicron, Delta, and everything else. It's still around.
No, we hardly see that now.
Okay.
Either they're non-existent or the numbers are so small there's no threat to it because they're outrun by the other XBB.
But they are still around.
I don't think so.
So have they mutated? Has the Delta become the Omicron, become the XBB? Or are there still various
Okay, I'm going to
variants
take you a
around?
little bit back into history. So, the original COVID virus that first came out of Wuhan, China, then after that, adapted, mutated. Think of it as in a horse race, and everyone was racing off. The moment you become the dominant strain, you will take over, and once you get infected the dominant strain, you learn to cope with the rest.
Oh,
Okay.
okay.
That means
Okay.
you forget the rest, and the rest have no chance to get a footing on the infectious stage.
Got it.
So
okay.
as then from Delta went on to Omicron, and Omicron went through the various strains, now to the XBB, it's actually 1.16 that is leading the charge, and is a little bit more infectious and more transmissible than the others. So we do have XBB 1.6, we do have some of the other variants before that, but the Alpha Deltas, they're all gone.
Okay, got
Okay,
it.
let's
got it.
continue to talk to Dr. Leong Hoe Nam, Senior Consultant, Infectious Diseases Physician from the Rofi Clinic on the Big Show TV. It is 8:17.
Kiss 92 Time Check brought to you by Putian. Introducing Putian's Dish of the Year.
Speak to anybody. Okay?
If you want to point.
Yeah.
So a question that's been brought up by Chun Jiet is Chun Jiet's gone through 3 shots for COVID.
Only 3 shots.
Only 3 shots. Is now the time for him to get the 4th?
It really boils down to the question. Everyone asks me this for that matter. Do I need another shot? It goes down to the question, can you afford to be infected? Okay, the truth is everyone will be challenged with COVID-19 regardless. I mean, Glenn's been sitting at his desk, he's working his ass off, especially listen to this. He's working his ass off here, but he still gets infected. Why? Where did he get it from? Can he afford to be infected? When it was infected, it was off the air for about 10 days, wasn't it? Yeah. So if you can afford to be infected, then that's fine. But I tell you, who are the people who can't afford to be infected? Number one, the elderly. Those people who are at risk, those people with diabetes, heart diseases, etc. If you know you're a little bit round in the center, my friend, you cannot afford to be infected. Because once you get infected, you're going to end up sick. You may need hospitalization. In fact, you may throw off your first heart attack or new heart attacks.
Wow.
And then you're totally out for the next, if you're fortunate, you're totally out for 2 weeks, 1 month. If you're unfortunate, you may even die from it. And that's the truth. But on the other hand, let's swing it to the other side. We have someone who's 20 years old, fighting fit, who has less than 10% body fat on him, goes to the gym 5 times a week, and then he has had 3 shots. He can afford to be infected. So you really look, you can't use the same a cookie cutter application for everyone.
Yeah.
You really need to go down and stratify through. From the Ministry of Health point of view, you look at it, how am I going to cookie cut everybody? You can't. So you just give out the recommendations. The more vaccines you have, then the less likely you're going to fall sick. Then the burden on the healthcare will be better. It makes sense from the Ministry of Health point of view.
Yeah.
But for yourself, then you have to assess your own risk. Do I need it? Can I afford to fall sick? Now, these are, and then mind you, I'll tell you the biggest spanner in the works, which I cannot even predict for my own children. The risk is hospitalization, and we can stratify that. Even for the kids, the risk of a bad outcome is about 1% if you don't get any vaccines. The worst outcome is actually about 1 in 10,000. That's quite low. But the biggest unknown is long COVID.
Yeah.
For my worst enemy, I don't even wish them long COVID because it's the most disastrous condition to
What
have.
is long COVID?
Yeah.
Okay,
let's
just
explain
very
that.
quickly, long COVID is a silly condition where the body has lack of energy, lack of thought, the cognitive decline. You just can't do anything. A marathon runner who does easily 10 kilometers a day will tell me that I can't get out of bed. It's too tiring. I can't think. If you ask them to add 1 + 9, they'll take a little bit longer. Oh, it's about 10.
My husband was like that for about 6 months. He had long
wow.
COVID. It was just like brain fog, super lethargic. I mean, he could still do like simple math and stuff like that. But as you said, different people react differently to it, right?
Correct. So the long COVID is the biggest unknown. Even though you have had your 3 shots, you may still get long COVID. Even though you're a 20-year-old gymmer, you still can long COVID, and it will take you out of your gym for 6 months. Think
Yeah.
of that pain.
Yeah. Now,
Yeah,
speaking of, you were talking about immunity and how people are all react differently to it. During COVID or during the pandemic era, we all had to wear masks. We were all extra careful washing our hands. I was like cleaning my groceries and everything, as they came through the door. Has that period brought or lowered our immune system so that now, once the masks have been taken off and people are a little bit more relaxed, that's why we're getting more sick with things like Influenza A and, getting sicker?
No,
Okay.
not at all. I'm going to make it very clear that has not lowered our immunity. That has raised our awareness to infections and stuff like that.
Yeah.
And those periods of masking, keeping our distance, etc., has kept the other viruses away. It hasn't been very, very effective with COVID because COVID is a lot more infectious. But for the rest of them, from influenza, RSV, adenovirus, parainfluenza, enterovirus,
Oh my goodness.
I can rattle on for the next 30 minutes.
Yeah.
But what I'm trying to tell you is when we had those measure-ons, those viruses were out, away from us. Very much as the same as when the country was in a lockdown. Travel was away from us. But when the country opened up, travel came back, we went out, and when we opened up, the mask came down. Guess what? The viruses came back.
Right.
When the viruses came back, you have 3 years where your regular cough, cold, runny nose, and your colds and influenza didn't hit you. We had our revenge infection, and the viruses had their revenge infection. Sorry, revenge travel and revenge infection.
Revenge travel,
Right,
yes.
right.
Yeah.
But okay, let's take me. I got Influenza A, and you get your Tamiflu, you get whatever, right?
Yes.
Now I'm coming to the end of it. Today is basically my last day of medication. Where do I stand with my immunity then? Is my immunity lower because I've had Influenza A, or is my immunity higher because I've been taking all this medication?
There are two ways to answer the question. The first part will be for the general public, your immunity is not lowered compared to your 1 week ago or 10 days
Okay.
ago. That's the simple answer to it. But you must understand about influenza, it's a little bit different. Influenza has bad bed partners. Bad bed partners, because at the back of your throat, you may actually have a bacterial infection called pneumococcus, which loves to pair up with influenza. And what happens is influenza will do the first punch. And then boys who have gone through the army will realize that as we are fighting the first punch, we ignore the right flank or the left flank. That's where the pneumococcus comes in and gives you a punch. So at this point in time, our Flying Dutchman here is at risk for getting a secondary bacterial infection.
Right.
And that's with pneumococcus.
We can hear it in his voice.
Yeah, you can
actually,
hear it in my
'cause
voice.
It feels like his lung is
very
infected.
itchy.
Seriously,
The throat's very
I
itchy.
don't think that has happened on him yet. Because if that happened on him, he would have high fever, he would be coughing,
yeah.
he would have a rusty sputum.
Right.
The catchphrase is a rusty sputum. He would be feeling so sick,
Yeah.
he can't even do the
But he's
push-up.
looking
Okay.
pale now.
But yeah,
looking
he's
so
always
pale.
pale. He's
pale.
always
No,
Always
that's
pale.
called allergy to work.
but doctor, with him still coughing, with this incessant cough that he
Coughing.
seems to have, does that mean he's infectious?
Am I infectious?
Is he
Yeah.
contagious?
Okay, when you're on Tamiflu, after the third or fourth day, you're no longer infectious.
Okay.
But the first,
Okay.
second to third day, you may still be infectious.
Okay.
The reason for the cough is not because that the virus is alive, but the back of your throat is injured. You feel the sensation that there's something wrong
Yes.
there, as much as there is a scratch after an injury. You know the wound is fine, but you just want to scratch it. And the same thing happens to your throat.
Got it.
So
got
you're
it.
actually responding to the swelling in the back of your throat.
Right.
Right. Okay. Got
Okay.
it. We have some questions on our YouTube which we can ask Doctor when we go on air.
Yes, but of course, I will ask the doctor a question of my own first.
Yes.
Please go
Okay,
ahead.
please.
Yeah, because they've got COVID and all that. I'm going on air to ask you if, I got the XBB. I'm not
don't
sure.
know. Yeah,
so yeah,
okay.
I'll ask you. There you go.
Kiss 92 traffic.
On the PIE towards the airport, right after the TPE, a vehicle has broken down. Look out for that. Also on the AYE towards Tuas, before Benoy Road's exit, a vehicle has broken down there as well. If you have any other news for us, it's 88550920.
Welcome back to The Big Show and The Big Show TV. Our guest for this morning is Dr. Leong Hoe Nam, Senior Consultant, Infectious Diseases Physician at the Rofi Clinic. We missed you.
I
Doctor.
know. I miss you guys too.
We haven't seen you for
so
about
long.
2 years, I think. At
Okay, so
least.
everyone owes me a kiss after this.
Oh, well,
okay.
I'm sure our listeners would like to kiss you as
Yeah.
well.
No, I'm not sure.
we need
about
some
that.
social distancing right now.
Now, Dr. Leong, Angel had COVID about 3 years ago.
Yeah, I think
For the
I
first
think
time?
2021, middle of the year sometime.
Okay.
Yeah.
And you had it twice, right?
I had it twice. So one the year after I had it, and the first time I had it, I lost my sense of smell and taste. So,
So-
that was a Delta period.
Would that be the Delta virus?
Yes, that would be the Delta
Okay.
virus.
The Delta virus.
Yeah.
So FD thinks he got the Omicron virus.
Because mine
this
was April last year.
Last year, yeah.
Yep, that will
And
be
mine was
Omicron.
about second time was about June last
Right.
year. Yeah.
I thought I had dodged it. I thought I would never get COVID. And then last week, you know, I tested and I was positive. Do you think I got the XBB?
You absolutely got the XBB.
Okay.
Yeah.
Okay.
The thing is, it was so strange because I was telling these guys I had no fever. Zero. No fever. I just had a blocked nose. And that was it. But I had never felt so ill in my life. Is
That's
that
surprising.
He felt his body burning up and stuff like that, but no temperature.
Yeah, just but that wasn't it.
No?
It was more just feeling ill, and I couldn't explain why
Achy.
because I had no fever, just a blocked nose. I had felt even more ill when I had influenza A just a week before, so it was a double whammy for me. But 9 days, the first 5 days, I felt completely okay. The following 4 days, I felt so ill. What happened, doctor?
I've no idea. The answer is I've no idea. You have a couple of things. You had the influenza earlier on,
Yeah.
and then followed thereafter you had COVID-19. I'm not sure you've really recovered totally well from influenza. So immunity might be a little bit lower,
see.
and then you are predisposed to another infection for the moment. Okay, number two, the COVID-19 is really an enigmatic virus. We think it's a common cold, we think it's going to be upper respiratory tract infection, but your problems are heart attacks, your problem of strokes, your problem of clots, your problems of long COVID, and many, many things thereafter. And just to throw a spanner in the works, you're about 2 times higher risk of getting diabetes
What?
after getting
What?
COVID.
How are the two
my.
related? What? How are the
How
two
are those
related?
related?
though?
Okay, so coming back, so
I had 3 eclairs yesterday.
Not a good start.
so what happens in Glenn? I can't really answer it. It really tells you that when you're sick with any illness, please chill out, don't go to the gym,
Yeah.
and try to recover as much as you can. But unfortunately, you had a kind of a Trojan horse. In fact, you felt relatively okay for the first 5 days,
Yeah.
and the next 5 days you were just knocked out.
Exactly.
I don't understand. And COVID-19, we're really rewriting medical books on infectious diseases after COVID-19. And the most important thing for the long COVID sufferers out there, at least, or those people who had chronic fatigue syndrome for the longest time, many doctors felt that this was a wacko's disease. I'm going to put it very crudely. This is a crazy person's disease because all the blood tests were all normal, but the person was feeling abnormal.
Yeah.
And then with long COVID, there's going to be tons of research on long COVID, and it's going to help many, many people with chronic fatigue syndrome. I think there's one plus for sufferers of that. Okay, I'm going to answer a quick one. Why diabetes?
Yeah.
Okay, so the virus targets a receptor called ACE2 receptor. ACE2 receptors is how it gets into the entry into the respiratory epithelium, that means the lining, and go into the lungs. But guess what? ACE2 receptors are found in many other parts of the body, and one particular part is actually the cells that make the insulin.
Oh, right. Okay.
So what happens is it goes into the respiratory tract, then the virus will try to go into the bloodstream. If it succeeds, then it will travel down, going to look for a home. And when it go past the pancreas, they realize that the islet cells of Langerhans, those are the ones that makes the insulin, welcomes them with open arms. They bind to it and destroys the islet cells of Langerhans. So your ability to form insulin comes down. The production factories for insulin comes down. So you're immediately at risk. If you're pre-diabetic, you become diabetic. If you're non-diabetic, you become a pre-diabetic. Not everyone gets it. Hence, the risk is about 2 times higher. And it's very, very apparent in kids. In kids, unfortunately, and that's where they first described it. And many of them ended up having insulin requirements. But this was also at a period before vaccination. Before vaccination, the risk was much higher. With the vaccination, the risk became lower.
But would this be diabetes A or B? Yeah, sorry, type 1 or type 2, because one is hereditary, one is lifestyle. How does this classify?
Okay, think of the insulin requirement in diabetes as the amount of insulin there is that's needed. If you're fat, then you need even more.
Yeah.
Then hence you have less of that. Yes, you could end up with type 2.
Right.
But if you are slim and you don't need much insulin to begin with, but the virus destroys everything, then you end up being type 1.
Okay, got it.
Okay. All right, let's continue this conversation with Dr. Leong Hoe Nam on The Big Show and The Big Show TV. We've got a voice note coming up as well. Keep it right here. It is Monday, the 24th of April.
Kiss 92 Day Check brought to you by Gain City Megastore at Sumai.
Okay. Should we...
Either or.
Go with
I
the
mean, we
voice
have
note?
some here, whichever.
Let's do the
Okay,
voice note.
voice note for Dr. Leong.
Maybe not.
Huh?
Okay, no?
Should be up in a minute.
Okay.
Okay.
Yeah, we have a question from Winston. He says, have private clinics stopped testing for COVID? A couple of weeks ago, he had influenza, tested COVID negative for himself, and then he told the doctor and asked for it, but the doctor said no, he didn't need to test. So have they stopped testing? And if they are testing, why aren't they telling us which strain we have? Because somebody else asked, why don't they tell us it's Delta, it's Omicron, it's this? Because I also didn't get labeled under which.
I've heard from a number of my friends, when they went to see doctors and all that, all the doctors are kind of taking it very lightly. It's like it's
COVID's
an endemic
done.
now.
Nobody cares.
Yeah.
Is that true?
Yes and no. Okay, so it really depends on the individual. And for that question, I can tell you that guy's young. He's not obese. He doesn't have chronic illnesses. So we will make and do tests if it makes a difference. If it's young and is expected to go through COVID with little or no problems, why test? I'm going to waste $20, $30. We can do it. And then, in fact, you can do it yourself as well. But we're going to waste that $20, $30 because it won't matter. We can't give you the antiviral medications. The use of antiviral medications is strictly controlled by Ministry of Health at this point in time. But however, if you are 65, 70 years old, you have heart problems, your kidneys aren't good, you have diabetes, etc., like our dear friend, then you would want to be tested. Once you test, it will entitle you to an antiviral medication.
Right. Okay.
So do the test only if it makes a difference in your treatment.
So you're saying the rest of us shouldn't test at all, whether we're sick or not? Don't test for COVID?
No, actually most of the time you don't need to test for COVID.
Oh, you don't? Okay.
The only time I would really want to test is I have an elderly at home and I want to stay away.
I see.
And just to reduce down
Or
the risk of
young
transmission.
as well?
Yes.
Somebody young as well? No.
The young ones, honestly, they are sharing everything in school, in the
they are.
kindergarten. Yeah.
No, but very interesting that we're talking about this testing because, Glenn, you were telling us when you came in this morning, before we even went on air, you've got an interesting issue with these ART tests.
Yeah.
Yeah, I mean, all these kits that we get, I feel like
They're not relevant.
they all give different results.
Spot on.
Okay.
It's just like different infectious disease doctors talking at KISS 92.
Yeah.
You have different results.
Yes, but we've got the best
We've
with
got
us
the best
today.
one, yeah.
No, okay, let's be serious here for a while. The different antigen tests have different sensitivities.
Okay.
So you can't say that they are all the same. And they are similar, but they are not the same. Number two, I've had test kits where an individual, a poor kid who has been away from school repeatedly because of a positive COVID test, but he feels totally well. He came to me and said, what do? I said, look, you actually don't have COVID.
Oh my goodness!
And what you have is a false positive test.
Right.
So to do that, I did a PCR, paid a bit of money, showed that, look, my friend, you don't have COVID. And I did it with my own test kits and it was negative. So don't rely on this because this test kit is not giving you the KISS. You are not getting the right test results.
Wow.
Now that COVID has mutated so many times over, are the test kits even relevant anymore? Because they were
Absolutely.
created for one type of strain.
Great question. Okay, I'm going to break you the science of it. So if you were to try to look at the virus, there are many, many parts of the virus. Look like the human body, there's a head and arms and body and etc. So the one that keeps mutating is where it attaches itself to the virus, and it's called a spike protein. But the test kits don't test the spike protein, they test the N protein. N stands for nucleo. Oh gosh. Okay, the N protein. The N protein there's a lot more of it made than the S protein. So if you want to do a sensitive test, you go for the biggest body part that's generated. It could be your hair. Okay?
Oh, right. Okay.
And then but that N protein has not changed much compared to the spike protein. So the tests are all relevant because they are not testing the mutated part.
Oh, right. Okay,
see.
just the
Right.
N part. Okay, got it.
I
Got it.
see.
Okay.
So back to the current XBB, right? What is the most common symptom right now, based on the patients that you see, of someone who's infected with the XBB virus?
Okay, I think it's still pretty much the same. We are still talking about fever, aches. For the milder people, they just have a bit of sore throat, cough, runny nose.
Some people say sticky eyes.
Now, the
What
sticky
is that?
eyes one came out reports from South Asia, but I do have my doubts on that. Now, sticky eyes has been reported COVID. Yes, it does happen. But does it occur more with the new variant, or they call it Arcturus? The answer is we don't know because there's no rigorous scientific publication. Why do I say that? Because there are many, many kids out there. In fact, if you were to go to a pediatric hospital now, 50% of the admissions in the kids' wards now are due to a virus called adenovirus, which causes sticky eyes.
And what is sticky eyes?
Just a little bit. It's also called the epidemic conjunctivitis. Do you remember when we were little kids, among our friends will say, you look into him, you're going to
You
get
get
sticky
Yes,
eyes.
exactly.
Untrue, right?
Okay, it's completely untrue. Okay, so that virus causes epidemic conjunctivitis. Adenovirus is the name. It's actually spread by droplets. So if I have adenovirus with me and I come into this room, my mask is down. Unfortunately, all three of them will get the kiss of the virus from me.
Because it's in the eyes.
Yes. No, it's because it's in the droplets in the throat.
in the droplets, right,
And then
okay.
it spread that way. Number two, and out of courtesy, Glenn Flying Dutchman, Angel will just shake my hands. But the tears will be my hand, the virus are my hands, and then I give you the shake of the virus.
Right.
So it spreads very quickly. And the third thing is, we might share a pencil, we might share an eraser,
gosh, yeah.
and the virus goes there. And guess what? Alcohol doesn't kill it. Okay. It can take a brandy to the tops and it still survives it.
Oh, man.
Told you.
Because for the longest time, I've been telling them, the reason why I have not gotten COVID is because, once in a while at night before I sleep, I have
A whiskey.
whiskey on the rocks.
And most
And
of them will
that's-
give you 30 to 40% alcohol. But to really kill it, you need about 70, 80%. Kids,
Oh.
everyone, don't try 70, 80% down the throat. You will go down to the hospital, we will have to take away your whole throat.
Yeah,
Oh my
it's
gosh.
really bad.
No petrol down the throat then.
Let's not do this.
Wow.
So do you think there is a wave right now? That's the question everyone's asking. Is there a new COVID wave?
Is it a wave?
There is a new COVID wave now. We're having a lot more numbers than what it was a few months ago. And there are a few reasons. The first reason is we do have a more infectious variant going around. It's a 1.2 times. But in the US, I do see something that's coming up more quickly.
Okay.
Okay, second
Maybe
reason.
we can go on
Wait,
air
yeah,
and
let's
talk
ask
about this.
that.
Okay. I'll ask you the new wave question again. Jesse J with Domino right here on Kiss 92, all the great songs in one place. Our guest for this morning is Dr. Leong Hoe Nam, Senior Consultant, Infectious Diseases Physician at the Rofi Clinic. I think I need to visit you very, very soon with regard to the flu vaccine. But right now, I just want to ask you, Dr. Leong, because everyone's talking about this, is there a new COVID wave happening?
Yes, there is a new COVID wave happening, and there are two chief reasons for it. Number one, we do have a variant that's a little bit more transmissible. It's about 1.2 times. The variant is able to evade the previous immunity which was conferred by previous variants. So, for example, it's like the PSLE exams. You could have done it back in the days in the 1980s. I aced it, but now I've got a new variant, which is a new test exam. It hits me, I fail it. Okay, so each time a variant comes along, it's like a new PSLE mathematics with new techniques and new methods. You just fail it.
Wow. Okay.
Number two. How the chief second reason is that after you get exposed to a virus, you have great immunity thereafter. But it's like a PSLE math. When you stop doing it after a while, you start forgetting, and then you are prone to it. And up comes a new test with a new variant, with a new mutation, then you fall sick again.
I see.
But fortunately for the bulk of the people, not everyone, you will actually do better. The next infection gets a bit milder and milder. The only thing unknown is, will you get long COVID with the second, third, fourth, or fifth infection? Unfortunately, it's like the guillotine. The threat of the long COVID always hangs above me, and I could get long COVID with each infection. Hence, WHO's stand is, don't get infected with long COVID at all. So it's to reduce down the risk of long COVID. But for the other group, there is a smaller group, which is about 2 to 5% of the population with heart problems, or what my friend calls it, the at-risk individuals. That's for you, Beverly. At-risk individuals, you will need... every infection could put you through the same risk of hospitalization, heart attacks, strokes, clot formations, long COVID, all over again. So it's like a nightmare on Elm Street. It keeps coming back.
But speaking of coming back, you asked about COVID-19. Something else that's going around is Influenza A. Is there a wave of Influenza A going around?
There is a wave of influenza. Think of influenza now as the science PSLE exams.
Oh my gosh.
Okay, so we need revisions of influenza. Now, the main influenza about 1 year ago was actually H3N2. Okay, now we're getting a bit of H1N1 and a bit of B, Victoria B. So there were actually 4 strains of influenza. You'd be happy to know that one hasn't showed up yet. I think it's really late for work.
Yeah.
We have the other 3 strains that are going around. Yes, you're right. You could get influenza A, you can get influenza B, you can get influenza A again. Yes, and not only that, I'm going to add in the list the 13, 15 viruses. Just like that. Parainfluenza, there's 1, 2, 3, 4. Then there's adenovirus, enterovirus, hand, foot, mouth disease, rhinovirus, there's ABC. So the list goes on and on and on. That's called life as usual.
What's the one that hasn't showed up?
Yeah.
There's one strain of influenza B called Yamagata strain of influenza B.
Is that like the worst?
No, it's not.
No, it's not. Okay.
It's actually the same as any other influenza, but at least one less problem to tackle with.
Okay.
So this Influenza A, it's just a strain. It's not majorly different from the influenza that we would normally get.
No, it's just the same as any others. It's not the bird flu strain or the porcine strain or the bovine strain. No, nothing at all. It's just the same. Now, some people, the problem with influenza is it's like COVID, it keeps mutating. Certainly not as fast as COVID-19, but as you mutate, then you fall sick again. As you mutate, you fall sick again.
Because you're immune to that, yeah.
And hence, you need the influenza vaccines. The influenza vaccines is to try to upgrade and update you so as to get protection. Unfortunately, a few things. Number one, I don't think that influenza vaccine manufacturers are making great vaccines. Okay, certainly the COVID vaccines are much better. Number two, we are always behind schedule.
Yeah.
We see the new virus coming up, then we ask the manufacturers to make it.
Yeah.
It take about 3 to 4
So
months.
you're delayed, yeah.
Yeah, so it's like you're responding to this program late. You're listening 3 to 4 months later. Forget it. You have to listen to KISS every day to get the latest update.
Of course.
Yeah, so that's the same thing. Unfortunately, the manufacturers for flu vaccine can't do it this
Quick
way.
enough.
They're quick enough. So they do it every 6 months, but well, it is what it is.
If I go for say a COVID vaccination, say a booster shot now, do I still need to go for the flu shot?
Yes, you do, because they are totally different. Think of it as a PSLE exam and a mathematics exam. Then you would have been boosted for your mathematics, but you're not boosted for your science. You fail on science, your dad and mom will be really upset with you.
I feel like your analogies need to be turned into like a Pixar movie. You know what I mean? I can picture all these little departments happening.
And I'm quite sure if we take the PSLE right now, we'll probably fail.
Oh, absolutely. You know how hard it is now?
So, doctor, how long before I can actually get the flu vaccine now that I've just recovered from COVID?
I would really like you to wait at least 2 to 3 weeks
Okay.
before you get the flu vaccine. Yes, do come to my clinic for the vaccination.
I'll look for you for sure.
Yeah, because the flu vaccine, I'm going to do a pitch for it. For those people who are at risk, please get the flu vaccine. Even if you do fall sick or flu, I will congratulate you even though you fall sick. The data is, if you get influenza vaccine, even though you fall sick, you end up with a milder illness. That means I've saved you from a hospitalization, saved you from ICU camp. Number 2, the second thing is those people who are living with at-risk individuals. So this could be my parents, my elderly parents, etc. I take the flu vaccine not for myself.
For them.
For them.
Yeah.
Okay, the third reason, and this is why SPH needs to push it down to everyone in the office, is you will reduce down the MC taking number.
Right. Okay.
yeah.
Got it.
Yeah.
Great advice there.
Well, thank you very much, Dr. Leong, for joining us today. I mean, I know we got in touch with you at such short notice, but...
And we wish we had more time. It's so much interesting stuff that we need to talk about. You need to come back again soon.
I guess so.
Yeah.
I guess so. When I need a crazy morning, I'll just come in.
Oh, please. Yes, anytime.
Thank you very much, Dr. Leong. We've been speaking to Dr. Leong Hoe Nam, Senior Consultant, Infectious Diseases Physician at the Rofi Clinic. I'll see you soon, Doctor.
See you. Bye.
The Big Show. Kiss 90.